Hello students. So today we'll be discussing about drug and nutrient interaction, basically the medicines, food and supplement interaction. So that is very relevant because there are many types of complex drug, nutrient and food drug interaction that can occur in the body. And that is very important that one should know what would be their drug and nutrient interactions to their body with the help of the consultant like physicians and dietitians. So get the ball rolling. What is drug nutrient interaction? A drug nutrient interaction is a reaction between medicine and one or more nutrients. Nutrients are the vitamins and minerals that are rich in food you eat. Vitamins and minerals nourish your body, help keep you healthy, and reduce your risk for chronic diseases. When a medicine interacts with a nutrient, it can keep the medicine from working properly. It can also decrease or increase the amount of the nutrient in your body. Let's say an example, like there is a drug is basically thyroxine sodium, which can be used for hypothyroidism, where we know the clinical parameters are T3, T4 level is lower and TSH level is higher, and the doctor prescribes some drug, like I'm taking some brand name like Eltroxin, Thyronorm, this kind of drug. But the drug has a very strong interactions between drug to drug and drug to food. That this drug is preferably physician suggested in take in the early morning in empty stomach, and after that some of the physicians forget to say that there has to gap at least 45 minutes after the drug consumed, and they shouldn't take any PPI, antacids, any calcium, any drink, tea like of this. So they should gap at least 45 minutes to 60 minutes, 1 hour. Then after they can have some food medicines, what the routine medicines they have. This is a very strong interaction. Okay, so this is an example where I can put there are lot many classes of drugs and food interaction that we can go through and learn. Drug and supplements also, there are supplements are there that will be a strong interaction between drug and the food supplement, what we can call the nutraceuticals and the clinical food or optimum nutrition. So that should be one must very careful about giving high protein, a high branched amino acid, high fat, high carbohydrate, gluten free, anything that what is the drug is going on. Because in our hospital, well, we do teach our students that in any cases in the IPD, they has to check the file, patient bedside file. That is very important, that what the doctor is writing and what the RMO is continuing, tempering the drugs, the titration the drug. So accordingly they can do. And the biochemical parameters, in dietetics, clinical dietetics, if we talk about the medical nutrition therapy or medical nutrition management, we should talk about the ABCT also. The ABCT is the anthropometry measurement, what we can do in our OPDs. B is the biochemistry analysis. Biochemistry means all the biochemical parameters, the clinical parameters, what the testing, like sodium, potassium, electrolytes, lipid profile, liver function, enzyme, whatever the tests are there. These are the clinical parameters. Being a dietitian is not, instead of asking what food do you eat, that is a part definitely. But apart from that, one should ask a patient, one should clinically, examine the patient. Like we all know what we do the community nutrition practical and the taking the classes, or also getting updated about ourselves rather. So we always, taking care of the hand, taking care of eyes, taking care of hair, taking care of nail, because there are bitten nail, toad skin, bloody eyes, anything is there. Basically, the community nutrition practical in the underprivileged people, but in also the privileged people, somehow some can occur. So that is very important to clinically they have to. So I'm again coming back the supplement thing. So drug and supplements is a strong interaction that we have to take care of. There is there is this dietary supplement and over-the-counter drug. Interactions between food and drug. This is very crucial. There are many types of complex drug, nutrient, and food-drug interaction that can occur in the body. Drugs and medications have the potential to produce many side effects, including changes in taste, appetite, digestion, and metabolism. While pregnant or nursing, consult a physician or pharmacist before taking any medication. Check with a doctor or pharmacist for the proper method and time to take the medicine. Refer to physician if health problem persist. Complex interactions between food, nutrients, and drug. Complex interactions between food, nutrients, and drug make it difficult to accurately determine the exact effects of these relationships in the body. A drug is defined as a substance used in diagnosis, treatment, or prevention of a disease. Drug-nutrient interactions involve changes to a drug caused by a nutrient that has to take care of us. Effects of food and drug intake, that is important. Drug absorption. Food or nutrients in the stomach or intestine may act to reduce the absorption of a drug by delaying digestion, binding to minerals found in the food, or adhering to food particles. In other cases, the food may promote drug absorption. Drug breakdown. Food may act to enhance or inhibit the metabolism of certain drugs in the body. Drug excretion. Food and nutrients may act to alter the reabsorption and excretion of drugs from the kidney. Other actions. Certain food components can lead to enhancement or opposition of the effects of some drugs. Some examples of food constituents found in food include vitamin, mineral, fat, protein, caffeine, or alcohol. Effects of drug and food and nutrition. Nutrient absorption. Certain drugs may increase, decrease, or prevent nutrient breakdown. Drugs may speed up the metabolism of certain nutrients. Nutrient excretion. Drugs can increase or decrease the urinary excretion of nutrients. What are the side effects of drugs and other medication? Taste and smell alternation, that is, the smell of certain foods. GI effects, some drugs can cause irritation, like that is like sometimes upset, sometimes nausea, sometimes vomiting, sometimes diarrhea, sometimes constipation, sometimes ulcer, sometimes gastric bleeding. So that is very important. There are lot of drug side effects are there because all the allopathical, any kind of drug or medicine, they have side effects. So that has to be checked. But adverse event something different. That is very harmful. Adverse mean harmful because some drugs have the results of angioedema. Some drugs have the results of hyperkalemia. These are the adverse events. So, but side effects is something nausea, vomiting, diarrhea, constipation. These are the side effects. Alternation in appetite may include suppression or stimulation, hunger leading to weight loss or weight gain. Organ toxicity. Since many drugs must pass to the liver and kidney upon excretion, hepatotoxicity and nephrotoxicity are of the primary concern. Metabolic effects. Some drugs may affect blood glucose levels by stimulating the production of glucose or inhibiting its uptake. Other drugs may inhibit insulin secretion, decrease insulin sensitivity, or increase insulin clearance from the blood. That is very important. Now we're talking about the drug-nutrient interaction. Antihistamine is the allergies drug basically to relieve or prevent the symptoms of colds, hay fever, and allergies. Interactions: take with water if GI disorder or distress occur, consume with food. Exception: there are exceptions is allograft viability decreases if taken with apple, orange, or grapefruit juice. Other drugs: avoid taking sedatives, antidepressants, avoid alcohol. Example: their example like cetirizine, Zydetic. Do not take with any juice. That should be, do not take with any juice. Arthritis of pain, like analgesic, basically to treat mild to moderate pain, fever. Food rapid relief, take on empty stomach. Caffeine may increase the rate of absorption of the drug, but avoid alcohol. Shouldn't be. Acetaminophen, tempra, these are the examples. NSAIDs, non-steroidal anti-inflammatory drugs. To reduce pain, fever, and inflammation, take with food, water, or milk to decrease stomach upset. With a high dose of these drugs, one may need to increase consumption of vitamin C, vitamin K, and the folate. Limit intake of supplements, limit or avoid products and affect blood coagulation. Garlic, ginger, ginkgo, okay, aspirin, Advil, naproxen. These are the basically the examples of the drugs. Corticosteroids to relieve inflamed areas of the body, reduce swelling and itching, allergies, rheumatoid arthritis, and other conditions. Take with food, milk to decrease stomach upset, limit grapefruit and other citrus fruit. While taking the drug, one may need to decrease sodium and supplement and diet with calcium, vitamin D, K, A, C, or protein. Caffeine, limit intake, avoid alcohol. So what are the basically the example? That is prednisone, cortisone, that is the example. Narcotic analgesic to provide relief for moderate to severe pain. Take with food or milk or decrease stomach upset, avoid alcohol. Codeine combined with acetaminophen, Tylenol, morphine, Roxanol. What is bronchodilators? Asthma to treat the symptoms of bronchial asthma, chronic bronchitis, emphysema. Take with food, stomach upset occurs. High fat meals may increase the amount of theophylline in the body, while high carbohydrate meals may decrease. Different foods may have varying effects on depending on the dose from caffeine. And theophylline, that the primetin means, these are the example of the bronchodilators. Diuretics, the diuretics also definitely help eliminate water, sodium chloride from the body. Because diuretics, we know diuretics basically water fill. So in case of the edema happens, in case of the pulmonary edema happens, for the heart failure patients, for the patients with the kidney or CKD patients, there's some all also the blood pressure, high blood pressure, hypertensive patients also. Doctors sometimes suggest diuretics. There you know very well the diuretics like furosemide, Lasix, the Dieter. These are all the examples of diuretics. To take an empty stomach, since food reduces drug availability, take with food or milk if stomach upset occurs. Since some diuretics cause loss of potassium, calcium, and magnesium, supplementation of these minerals may be necessary. But again, this is case specific. If the patient is taking diuretics, patients have hyperkalemia, you shouldn't be go for more potassium. So all our things is not theoretical, but practically also you have to apply your brain before prescribing something. And also potassium sparing diuretic when taking trimethoprim, avoid eating large amount of potassium rich foods such as bananas, orange, GLVs, lemon, these are things, and salt substitutes, but avoid natural licorice. Cholesterol lowering drug, basically if we talk about cholesterol lowering drug, we do think about statin. So there are rosuvastatin, simvastatin, atorvastatin, all of the Zocor, these are Rosuvas, these kind of drugs are there. So there are what is the use? Use take with food. Do not take with grapefruit or other citrus fruits. Definitely follow a diet low in cholesterol and dietary fat. In case of these kind of cases, in cardiovascular cases, we used to prescribe DASH diet, dietary approach to stop hypertension. Follow the guidelines of the modern guidelines of the DASH diet. Accordingly, we can make a medical dietary plan for the patient. Do not take with drug with any kind of codorant, basically. Beta blockers to decrease the nerve impulse to blood vessels. The beta blocker, basically nolol, lol, this kind of things, the suffix with the any kind of beta, propanolol, metoprolol, these are the beta blockers example. Take with food to increase bioavailability. Take separately from orange juice and avoid natural licorice. It may be necessary to decrease dietary calcium and sodium, which may decrease absorption. Take 2 hours before or 6 hours after calcium supplement or antacids. Avoid alcohol. Nitrates to relax blood vessels and lower the demand for oxygen by the heart. Food, take on empty stomach with water and increase absorption. 1 hour before meals or 2 hours after. Avoid alcohol. You shouldn't take alcohol. Alcohol should be avoided. Why? When nitrates, basically in case of relax of blood vessels, sometimes you have an angina pectoris, chest pain, cardio-related chest pain. Sometimes their nitrates can be prescribed. Isosorbide, sorbitrate, nitroglycerine. These are nitrates basically. Here's the example. Then we're talking about the angiotensin converting enzyme, AC inhibitors. I think those who have followed the renal pathophysiology and MNT slides of mine, they can see what is angiotensin converting enzyme, AC inhibitor, because in that slide I have discussed what is the RAS pathway. In that cases, it's the function to relax blood vessels by preventing angiotensin 2 a vasoconstrictor from being formed. What is the food? Take captopril, captonin, or moxidil on an empty stomach 1 hour before meals, since food decreases absorption. High fat meal decrease of absorption. Ensure adequate fluid intake. Avoid salt, calcium, and natural licorice. Again, ensure adequate fluid intake is very theoretical. In case if you see a patient is not having diuretics, having a very edematic pain, edema is there, so you shouldn't go for the fluid intake. You should talk to your doctor and see the clinically if you have in a hospital setup, then the water intake and the urine output. Accordingly, you can make your fluid balance chart. Captopril, gestrel, moxidil, these are the example of the angiotensin converting enzyme, ACE inhibitors, and also enalapril. Now we'll talking about the HMG-CoA reductase, basically known as statins, intended to lower cholesterol and reduce the production rate. Basically, avoid grapefruit, treated citrus with atorvastatin, lovastatin. These are the statin basically. In cases they should be avoid alcohol. That is very important. Avoid alcohol. Alcohol shouldn't be prescribed any point of time. It might be some good benefits, but that is very theoretical. Okay, so don't go for any gimmicks. Don't go for any kind of non-research or just a post kind of things. Also, you should always 1,000 times measure before prescribing something, because that should be proper randomized controlled trials and the research and study. Anticoagulants to prevent the formations of the blood clots. Limit foods with vitamin K, since it produces blood clotting substances that reduce the effectiveness of the anticoagulants. Do not exceed the upper limit of vitamin E and A. High doses of vitamin E, that is 40 international unit or more, may prolong clotting time and increase the risk of bleeding. Supplements: avoid garlic, ginger, ginkgo, and the horse chestnut. Do not take with the codron, intended abnormal heart rhythm, because there are some type of arrhythmia may be there. So if you take anticoagulants, you should take care of the vitamin K and vitamin E, what has been prescribed. Now we'll talk about antibiotics and the antifungals to treat infections caused by the bacteria and the fungi. What are the general guidelines? If you experience skin rashes or diarrhea, if you are using birth control, consult with your healthcare provider, because some methods may not work when taken with antibiotics. Be sure to finish all of your medication even you start feeling better. Take medication with plenty of water. So take medication with plenty of water, that should be done, but the checking with the medication, that you should talk with the physician, the healthcare practitioner. Penicillin, we know the penicillin is a class of antibiotic to treat infection caused by the bacteria and fungi, but some patients have penicillin allergy, that you have to check. Take on empty stomach or 1 hour before or 2 hours after food. If upset stomach occurs, take with food. Avoid guar gum. Use caution when taking vitamin K. Penicillin, amoxicillin, ampicillin, these all are the classical examples. Now we'll talk about quinolones to treat infections caused by the bacteria and the fungi. Take on an empty stomach 1 hour before or 2 hours after meal. If upset stomach occurs, take with food, but not with dairy or calcium fortified products. You shouldn't take milk that time. Taking these medications with caffeine containing products may increase caffeine level, leading to excitability and nervousness. So avoid the coffee and caffeine products. Ciprofloxacin, levofloxacin, ofloxacin, these are the solid classical examples. Now talking about the cephalosporin. To treat infection caused by the bacteria and fungi, these are the basically the drug used for the interactions. Basically, to taken on an empty stomach 1 hour before or 2 hours after meal. If upset stomach results, take with food. Take 1 hour before antacid supplement. We know this cefadroxil, cefixime, cefprozil. These are the classical example of the cephalosporin class of medication. Macrolides. We all know the tablets like azithromycin, this is the class of the macrolides. To treat infection caused by the bacteria and fungi, may take with food if stomach upset occurs. ZMax should be taken on an empty stomach 1 hour before or 2 hours after food. Avoid taking with citrus fruit, citrus juices, and carbonated drinks. You shouldn't take any aerated drinks with the macrolides, because some patients have strong penicillin intolerance or allergy or penicillin shock. So doctors sometimes convert to macrolides, but you have to make sure the food group shouldn't be there, like citrus fruits, like carbonated. Okay, example I have told you earlier, like azithromycin, zithromax, clarithromycin. That's a classical example. Mycin with the suffix with macrolide. Sulfonamides to treat infection caused by the bacteria and fungi. Take with food and at least 8 ounces of water. Avoid alcohol. Basically, the Bactrim, Cetra, these are the examples. Tetracyclines to treat infection caused by the bacteria and fungi. Take on an empty stomach with 8 ounces of water. Avoid taking tetracycline with dairy products, antacids, and vitamin supplements containing iron because they can interfere with the medication's effectiveness. Tetracycline, minosin, these are the examples. Nitronidazole to treat infection caused by the bacteria and fungi. May take with food to decrease stomach upset, but food decreases bioavailability. Avoid alcohol. That is flagyl, this and the example of the nitronidazole. Antifungal, take with food to increase the absorption. Do not take itraconazole, Poronox with the grapefruit or related citrus. Avoid alcohol. So Poronox, so you shouldn't take with the grapefruit related citrus. So citrus fruit is good, but citrus fruit is not with the medicine is allowed. So that has to be taken care of. Now talking about the mood disorders, like some neuromedicine. So MAO is monoamine oxidase inhibitors, is very classical kind of a drug group to treat depression, emotional and anxiety and disorders. These medications have many dietary restrictions and those taking them should proper guidelines, like alcoholic beverage shouldn't be there. Avoid food high in tyramine also there. These include cheeses, soy sauce, tofu, miso, fava beans, caffeine. These are there, but avoid alcohol strictly. So that is very important in case of if you take any neuro medicine. So that you have to take care of it before taking the medicine. Anxiety, anti-anxiety drug may take with food with upset stomach occurs. Limit grapefruit and citrus consumption. Caffeine may cause exhibitory nervousness. Supplement use caution with sedative herbal products such as kava, such as caffeine, guarana, or mate. Basically, the alprazolam. We know the alprazolam, alzolam, this kind of diazepam. So these all the anti-anxiety drugs. So that has to be taken care of the food group. Anti-depression drug, depression in case of depression. To treat depression, emotional and anxiety disorders, these medications can be with or without food and avoid alcohol. Okay, basically sertraline, fluoxetine, Prozac, Zoloft, Paxil, these are the antidepressant drugs. Now talking about the stimulant. Take with or without meals, limit caffeine and ensure adequate calcium intake. That is very important. Ritalin is an example of this drug. Depression, sedative hypotonic, do not take with food or immediately after meal, like Ambien, Zolpidem. These are the depression drugs. Stomach histamine blocker to relieve pain, promote healing, and prevent irritation from returning. These medications can be with or without food. A bland diet is recommended. Take drug 2 hours before. An iron antacid supplement is consumed. May decrease iron and vitamin B12 absorption. Caffeine products may irritate the stomach, so avoid alcohol. So avoid caffeine, avoid alcohol. Cimetidine, famotidine, ranitidine, nizatidine, these are the histamine blockers, H2 blockers. Now seizures, anticonvulsant or anti-epileptic therapy. Okay, epilepsy we know. Take with food or milk to decrease stomach upset. Avoid grapefruit or related citrus fruit, charred fruits or pomegranate juice. Supplement with calcium and vitamin D. Avoid alcohol. Tegretol, carbatrol, these are the seizures medicine, basically anticonvulsant medicine. That has to take care. So this is all about the drugs we have discussed about the food and drugs nutrient interaction. This has to be taken care of. But in case of their drug and supplement interaction, because there are some supplements, they have to be taken care because in case of diabetes, if I talking about diabetes alone, type 2 diabetes mellitus alone, with no other comorbidities or complication, then a certain supplements can go. Those supplements have sucrose free, high dietary fiber, good amount of micronutrients, good amount of macronutrients, low saturated fat, and also covering all these things for FSSI and also the RDA approved. But if the patient have the same diabetes with kidney disease, like diabetes nephropathy, we shouldn't do that particular food supplement to that patient, because in that particular food supplement or particular nutraceuticals, clinical food or optimum nutrition have the normal potassium level, normal protein level, but that has to be calculated. You shouldn't go the high potassium or normal potassium level for a hyperkalemic patient. That will be much more, what I will say, adverse events for their kidney and for their renal. The patients can be the CKD patients. So that has to be take care of. Or the patients have gluten intolerance, lactose intolerance. We shouldn't go the normal supplements to, stopping, closing your eye, and blah 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 for a theory. Theory should be there for the knowledge that has to be regularly. We have nurtured. There is a no-ending study. Till our end, the study will be goes on and on. But practically, when you see the patient, you have to make sure the clinical part and also tally with the theory, because you can't blindly apply a theory to a patient. Practically they have some comorbidities and the complications. That is the point, that is the moot point while we're talking about the drug, diet, supplementation and food interaction. Hope you have enjoyed these slides. If you have any questions, just jot down and talk to the respective department and get back to me. Thank you so much. So these are the reference. I'm just showing all the reference I have taken for making. Thank you.